So my topic is Toxoplasma gondii, particularly in relation to human health. So what is Toxoplasma gondii? Some background information is that its domain is Eukaryota, its kingdom is Prostisa, its subkingdom is Protozoa, its phylum is Apicomplexa, its class is Sporozocyta, and its order is Eukaryota. So background information continued is that the Toxoplasma gondii is a protozoan parasite, and this is a single-celled parasite that infects nearly all species who are warm-blooded animals, including the human species. This causes toxoplasmosis. The parasite can live for long periods of time in whatever host it possesses. This is due to the lack of symptoms that arise as a result of this parasite invading as a result of the parasite invading the species immune system. The immune system does an extremely good job of keeping the parasite from causing any illness. So toxoplasma in relation to human health. Toxoplasmosis affects an individual's neurodegeneration and cognition. In particular, the correlation between Alzheimer's disease and T. gondii is supported by the idea that the CNS pathogens may be drivers or potentiators of Alzheimer's disease. This idea arose because of the neuropathological findings in Alzheimer's disease that can be observed in CNS infections. Continued. Toxoplasmosis, which is the infection with Toxoplasma gondii parasite, has been found to affect the personality and behavior of the human that they invade. Some changes range from increased aggression, increased risk for motor vehicle accidents, decreased reaction time, and excessive alcohol consumption. Toxoplasmosis also has been discovered to affect an individual's mental health. According to a recent study, a correlation between Toxoplasma gondii seropositivity and schizophrenia. So how is Toxoplasma gondii transmitted? So cats are known to particularly contract this parasite. So when individuals encounter cat feces, they are more likely to accidentally consume the parasite when cleaning a cat's litter box or even touching or ingesting something that has encountered the cat feces. Continuing in how it is transmitted, it is also transmitted through eating undercooked or contaminated shellfish, also through the accidental consumption of undercooked or contaminated meat when, for example, if your hands are not washed. Drink fluids that are contaminated with the parasite from mother to child during childbirth, and when an individual receives an infected organ through transplant or blood transfusions, although this is extremely rare. So some symptoms for toxoplasmosis in a general sense is fever, swollen lymph nodes, headaches, muscle aches and pains, and sore throats. There are some complications of toxoplasmosis. It can be defined as both ocular toxoplasmosis and congenital toxoplasmosis. Ocular toxoplasmosis is the infection of the eye caused by the parasite, and a congenital toxoplasmosis is a disease which occurs in fetuses infected by the toxoplasmosis. So some complications of ocular toxoplasmosis is the loss of eyesight, a squint, clouding of the eyelids, eye shrinking, and the loss of cells and tissue from the optic nerve. Some complications of congenital toxoplasmosis is death, permanent brain damage, permanent visual impairment, learning disabilities, hearing loss, ocular toxoplasmosis. So to understand the extent of the infection on a global scale, Toxoplasma gondii has infected over 6 billion individuals worldwide. The prevalence in these particular countries are as follows: 6.7% in Korea, 12.3% in China, 23.9% in Nigeria, 46% in Tanzania, 47% in rural France, and can be as high as 98% in some other regions of France. Particularly in the United States, about 14% of people are positive with Toxoplasma gondii by the age of 40. There are about 1 million new cases every year. Of these million cases, 20% of them are retinal infections and are about 750 deaths annually, making it the most common cause of deaths related to foodborne diseases. So the outlook for individuals who have toxoplasmosis are: 1, pregnant women should seek a doctor. With the help of your doctor, they can create a treatment plan catered for you. Upon giving birth, it is known that a newborn can receive treatment for up to a year, and a plan should be conceived to foresee this. 2, people with immunocompromised systems, which is people with HIV, AIDS, things of that nature, should be hospitalized for treatment, specifically to prevent the complicated noted above. If a patient is not pregnant nor immunocompromised, it typically takes several weeks to recover. If symptoms are mild, your doctor might not even prescribe any medicinal treatments because it'll go away on its own. So now we're going to follow the cycle of Toxoplasma gondii infecting different hosts. So one, the oocytes are shed in the cat's feces as shown. Host in natures like rats and birds become infected after ingesting the soil, water, or plant in the environment which are contaminated. When cats ingest hosts such as rats and birds in nature, they are infected with the oocytes. Then animals like pigs and sheep are infected when they ingest the oocyte from the environment, similar to how rats and birds are. Humans, we explain that they receive it from infected food and water, undercooked meat of animals that are infected, blood transfusions, and from mother to child. So, in conclusion, there's measures to alleviate the issue of toxoplasmosis. Traditionally, diagnosis of toxoplasmosis is mainly based on the results of serological tests detecting anti-Toxoplasma gondii specific antibodies in a patient's serum sample. In recent years, studies have shown that recombinant antigenic proteins of Toxoplasma gondii may have an alternate source of antigens, which are more useful for serodiagnosis of toxoplasmosis in humans. This new way of diagnosing T. gondii not only helps in diagnosing the infection, but also has now developed the ability to differentiate between acute and chronic phase toxoplasmosis. The determination of the stage of T. gondii infection is important for pregnant women, particularly because primary infection during pregnancy can put the child at risk of serious medical problems. The accurate diagnosis of acute infection in pregnant women is thus critical for clinical management of both the mother and her fetus, thus explaining its significance for new methods. And this is my works cited page from all my sources. All my sources except for one were all primary sources of individual case studies. And that's it.